the sort of rest of their life regretting it. Right, welcome everyone. My name is Chris Maguire. I'm the executive editor of Business Cloud, and I'm hosting today's discussion, which is entitled "How Data is Driving Innovation in Medicine and Healthcare." They always bring me on straight after lunch, or where they're trying to make up time. So this discussion will last about 3.5 minutes, but it will be the best 3.5 minutes you have today. I'd like to thank all our sponsors, especially Cowgills, who are on the panel. We've got a panel that, quite frankly, money cannot buy. They're free. So let me introduce them. Keith Errey, pronounced, his business is Isansys. James Kennedy of Cowgills, Emma-Louise Fusari of In-House Health, and last but not least, Rory Cameron, who can't be missed, from Gendius, at 6'7" tall. So I'm going to come to you first of all from Keith. Now, lots of people have come from far and wide for today's event. One of the organisers has come all the way from New Zealand, but Keith actually hails from Sydney in Australia. Isn't that right?
That's right.
Absolutely, absolutely. Now, technically, you live in Oxfordshire, so it's not as impressive as I'm making out. But you've come all the way from Oxfordshire today. Before we talk about your business, I'm interested in your background, because am I right in thinking you started life in a mine in Australia?
Yeah, when I first left school, I studied mining engineering and, spent a little time underground in the coal mines. But in Australia, anybody remembers back to the miners' strike here and so on. In Australia, in New South Wales, you wouldn't work a seam unless you could walk through it. And when I heard what was being mined in Britain later on, this kind of thing, crazy, crazy. So actually it was geology that killed Arthur Scargill in the miners' strike, not Margaret Thatcher. So
they didn't expect to hear about the 1984 miners' strike. Yeah, but that's what we like to say. Look, you're in the wrong room, anybody, because we're talking about the miners' strike.
There's a lot of...
My dad was a miner in the 1984 miners' strike. But hey, we're going to move on, because I don't think they want to hear about that. You came to Oxford University. You were involved in a spin-out called Oxford Lasers. You've been involved in Oxford Synergetics and Tamaz before setting up Isansys. Just tell us a bit about what that business does.
So Isansys, what we do is we touch the patients, we connect patients to the digital fabric or digital infrastructure. One of the reasons for doing that is when you do that, then you have a remote patient monitoring system. So we make wearable devices. I'm wearing some at the moment, which give very accurate, continuous data sets, which then represent the physiology of a patient. And once you get to that, then you can start to, you can see what is happening to someone in real time. And you can start to take that data, because they are the best data sets for this, continuous, complete data sets. You can start to build AI models, machine learning models, and predict or use them for digital therapeutics or diagnostics. So that's what we do. And
you were saying to me earlier that it's a bit like patients when they're in ICU, then they're monitored, all their vital statistics are monitored, but when they leave, they're not. So the way you work, you attach sensors to these people, so you can check their heart monitor, their temperature, whatever it is. And if you set parameters, if it goes below or above it, it sets an alert and contacts the care staff. That's the way it works.
That's right, yeah.
Right.
Yeah.
What sensors are you wearing right now?
So I have a cardiac patch on, and so it's analyzing every heartbeat. And from that, it's giving me a heart rate, which is kind of trivial, but also giving me a respiration rate.
Yeah. Right, okay, so if I suddenly hear an alert, something's gone badly wrong. You collect the data. Where does the data go?
So the data goes into the electronic medical record. And this is one of the key things that we can provide, which we can drop a system in, and the data then can be integrated directly into the EMR along with all the other patient data. And so in that way, it's kind of like an integration platform that we have as well, because connecting all those things up, anybody who's ever tried it, is quite challenging.
You collect a lot of data, but the key is it's got to be accurate, hasn't it? Because you've only got to get it wrong a few times, and then you can get a bad reputation. So how do you make sure your data is accurate?
Well, that's because the whole thing is a regulated medical device. So what we're actually doing is selling data to the healthcare providers. And the thing about the data is interesting, that if you have very, very good data and you're feeding that into your machine learning model, those models can be vastly less complex and use vastly less computational power than if you're having lots of dirty data, and most of your AI is being used to clean up the data so that it can be correlated in some way and make sense.
I mentioned the fact you're from Australia at the start.
Yeah.
Partly because you're a very keen surfer, aren't you?
Well, I used to be. It's
Okay.
a lot colder here.
It is, absolutely, absolutely. Listen, thanks very much. Anyone who doesn't know me, I always say you're the best speaker we've had so far. Anyone who's seen me before and you've heard that joke, don't laugh. Okay,
You've got to do it 3 times.
Lots of people have heard that joke before. James Kennedy, you're a partner at Cowgills. And we were talking before, actually, you've got a mobile phone and it's set to go off. If it goes off, it's like a sensor of your own, because I'm right in thinking your partner isn't far away from having your first child, is she?
Yeah, Feb 12th, first baby. So
okay. Isn't that nice?
yeah,
nice.
then if it does go, I'll just make a beeline and I'll go.
Okay, yeah. You've got about 7 or 8 minutes to kill first, but after that you can go whenever you want.
She'll understand, I'm sure, Chris. That'll be fine.
You work in the corporate finance department at Cowgills, okay, and you've been there and you're increasingly working in the healthcare sector and the health tech sector as well. But Cowgills has grown, hasn't it? And you've had to move offices as well. Tell us about that.
So we as a firm, corporate finance team has more than doubled in the last 2 years. So there's 32 of us now, 6 partners. As a firm with 230 staff, and the name, which is difficult to pronounce with a northern accent without sounding like something similar, was set up by Peter Cowgill, who until recently was the executive chairman and CEO of JD Sports. As a firm, we're a full service advisory practice, and I think where our unique skill set is building long-term relationships with our clients and understanding along their journey there will be different needs and requirements that business needs, and we've got all the services in-house to be able to support them. So it's really fascinating journey for myself, and we're now moving office again in the new year to accommodate the growing team.
Okay, anybody wondering where all the food's gone? Lady from Pro on the front row has literally got the world's biggest. I'm not kidding you. Literally, if we get a lock in, she's the lady we're coming to. Absolutely, it's literally like huge. Could break a wrist on that. We were talking earlier, and you said actually, I've not really. It's Christmas, so we have fun at Christmas. That in terms of health tech, you've not done a health tech deal. But increasingly, the companies you're working with have got a health tech element, you know. So we were looking at some of the businesses: diagnostic healthcare, community health and eye care, window to the womb. I hope you got a good deal on that one. But what's the market? Everything's linked. What's the market like at the moment? What are you finding in terms of health tech?
I suppose the market overall in the last few years has been fairly extraordinary. I think we've had probably 20 years worth of big events happen in the space of 3 years, whether it be the pandemic, whether it be Russia, whether it be inflation, whether it's the OTS saying that the capital gains tax may change any day now. So it's all of that has just meant there's been a lot of activity and sometimes frenetic activity. I'd say with the market, if I start with the pandemic, I think there was mixed fortunes. Clearly, there were certain sectors that almost immediately switched off to M&A, whereas those that, you know, really it was a test of those sectors where they could demonstrate resilience to the market challenges. So healthcare, which has always been popular, technology always been popular, or health tech, that was one where the NHS, in the immediate aftermath of COVID, almost switched off any elective care work. It all came very much focused on emergency care services. And what that did is it created a patient backlog in the millions, and the patient lead times just significantly grew. And it was ultimately, it was a mistake because the independent service providers are critical to providing healthcare. And I think, you know, as I mentioned about the market, because certain sectors switched off, and private equity in particular have raised funds with the primary purpose of generating a return for their investors, there's fewer homes for that pot of capital to go to. And healthcare, you know, demonstrated because of the backlogs, because the NHS couldn't provide the care without them within elective care, that they turned on again very quickly. And what you had is a huge concentration of deployed capital going towards fewer homes. And for us, healthcare was where we spent a lot of our time, because we just found that, private equity are extremely interested, as were trade buyers, of getting within the space.
You used an example though, didn't you? You said that Redmore Health and Shorey, a company I know quite well, just taken some investment from Palatine, and they were courted by, I think, 13 different PE investors as well. So people are looking at that as being, a real barometer, a real benchmark for the future.
Yeah, I think that's a great example. So Redmore is a relatively new company, hasn't filed a full set of accounts, and that's normally the telling point for when people track a company, is they file a set of accounts and every advisor and private equity house can access that company's house and go, oh, this is a really interesting company, it's growing so quickly. Redmore, it was even before that, it'd been identified, 13 private equity houses are constantly, and probably as many advisors, including Cowgills, I might add. And I spoke to Mark Schmitz, who's the MD there, and it's because of the opportunity for that business to scale that for the likes of Palatine, it's a great business that they want to work with. And I think that, Orca's another one where, I've just seen that they've won an award as one of the deals at the Insiders, or equivalent of the Oscars. The likes of Orca and Redmore, using a World Cup example because of the timing, they are the Jude Bellinghams and the Mbappes of the M&A world. They will be followed and tracked by, so many parties because of that opportunity to scale so significantly.
Just final question, if I may, before I come to our next speaker. If you were making a cake, okay, the perfect healthcare business, the perfect healthcare products, what slice of that cake would be made up of innovation, and what slice of that cake will be made up of data? Because increasingly data is the buzzword, isn't it?
I think the two go hand in hand. I think ultimately, if I could create the perfect healthcare company, I think it's one that the end market has to have scale capability. Ultimately, if the ones we've looked at have been within ophthalmology or diagnostic imaging services, where, say, diagnostic, the UK unfortunately has one of the lowest number of diagnostic equipment per 100,000 people in Europe. We're shocking behind it. That is a business that has developed technology, state-of-the-art scanners, electronic patient record system that means they can provide a much more efficient service. So when we talk about the perfect healthcare company, one, ultimately the end market has got to be there. Two, the technology is often the critical factor which makes them more efficient than others. And every company we've worked with, technology, whilst they've not been data sales led, they use data to become more efficient. Community health and eye care could treat patients in about a quarter of the time that you would typically have with the NHS lead time. Diagnostic healthcare, very similar. Is technology is a critical factor. And the last piece of the puzzle is people. So ultimately, private equity, as an example, they back the team, not the business. And I've heard my favorite one is back the jockey, not the horse. Where if the team that driving that business, if they are credible, the end market's there and the technology supporting it, that's critical.
James, thanks very much. Excellent. Going to come to Emma-Louise Fusari. Whenever you do events like this and you've got lots and lots of speakers, it's very easy to forget who said what, unless you can remember the speaker. So what I'll do, I'll always drop a fact in that's not relevant to anything else at all. Emma, you met and you won a husband at poker, didn't you? Tell us about that, but keep it short.
So I won a few £1,000s and he won a wife. I think that was the
You met a guy at a poker table and you ended up getting married to him.
I did, yes.
Okay, absolutely. That's what people go away with today.
He's been winning ever since.
Okay, and you've been together for how long?
12 years.
Okay, so before we talk about in-house health, your background is as a nurse. You
Yes.
qualified as a nurse 20 years ago. You left because you became frustrated by the red tape, the bureaucracy, the politics. You're also a walking, talking example of data, because people are looking at you right now and they're saying, what's that there? That's what they're saying.
Yeah.
You're a type 1 diabetic. You've
Yes.
been a diabetic for 30 years. If you want to see how data's changed your life, you've gone from having a blood on a stick to test your glucose levels to having an AI-powered insulin pump, which is sitting in your back pocket right now as well. I mean, that's just one example of how data's changed healthcare, isn't it?
Yeah, absolutely. The ability to take a chronic disease that has terrible outcomes for patients and people and their families and communities, and to have, Keith had touched on it before, that real-time data that you can act upon to have improved outcomes is unbelievable. And what I know it's a health tech conference, but one thing I would like to say is I help tech companies with burnout in their people because they are always on. And I think as we move more towards medical devices and people wearing technology, technology is not for everyone. Constantly I'm having alerts and buzzing and alarms going off, and people get monitoring burnout when that happens. So we don't want to disengage people from looking after and controlling conditions because of technology as well.
A really interesting point, because like Keith's got a cardiac monitor on, you've got an insulin pump in your back pocket.
Yeah.
You know, James has got a phone call in case his partner rings to say she's going into labour. So our lives are in some degree or other dictated to by tech, but you can get tech overload as well.
Yeah.
You set the business up a couple of years ago. It really took off during COVID, didn't it? Because you saw the way COVID was dictating our lives. Yes, you can see your families. Yes, you can go to the restaurant. And you thought to yourself, you know what? I'm going to launch in-house health, which takes a data-first approach to work-related stress. So just explain the way you work in your business.
Yeah, so we go into an organisation, we look at the operational frameworks around employee wellbeing, we collect employee health data through individual employee health checks, taking a holistic approach. There's a huge push at the minute on mental health and wellbeing, but it's really important that we look at all areas of health and wellbeing, including the culture of that organisation. And we use that data to identify the current problems and predict future risks, and provide training and education for everyone within that organisation to ensure that they are getting to the root cause of problems, because currently most of the things on the market are fluffy, reactive and not measured.
Yeah, just an update, actually. Lady from ProMan's still with a big plate of food. She's not finished it all. It's down there. Clearly, she's saving it for dinner and breakfast tomorrow. So let's say you went into a business like Cowgills and you both checked. You go into that business and you would do a 45-minute audit with him and find out what?
Yeah, a health check on James. So we would look at his physical health, his mental health, his lifestyle behaviours, his financial well-being, and his opinions and thoughts on the workplace culture, whether it's a safe environment to be.
So then what you do is you'd interview everybody, do the same audit, and it's all anonymised.
Yes.
Okay, but you might find, for example, that that people drink too much, that people smoke too much.
Yeah, so
they take time off work. What do you find?
Yeah, so at the minute, common themes we're seeing are severe anxiety amongst people. Obviously, we're coming out of a pandemic, cost of living crisis, increased alcohol dependence is one. We've seen a rise in that during COVID.
Stop looking at me when you say that.
I'll look at someone else, pick someone in the audience. Yeah, we've seen a rise in obesity.
Look at Sam instead. Yeah. Alcohol dependency. Look in the front row. Okay. So, but some people might say, well, what's that got to do with business? Everything, because it's impacting on people's productivity and engagement, and not just their ability to reach their full potential, but the ability that businesses need to sustain being profitable in the current climate. Just final question, if I may, before I come to our final speaker. In terms of, you touched on it earlier, wearable tech.
Yeah.
You think wearable tech is going to grow, but it's not a panacea, is it? Because you can't rely just on wearable tech.
No, and I said it and Keith said it, like having that real-time data is really important. We've always had data to shape policy, making decisions and therapies and treatment. But I think actually as humans, we're not ready to make decisions and behavioural changes based on technology. I think people still need to feel accountable to another human to inspire them and motivate them. Okay, nice one. Thank you very much. As I said, I always try and drop a fact in that's not relevant to the topic of conversation. Anybody watch Blind Date with Cilla Black? Anybody watch that back in the day? Okay, absolutely loved it, didn't we? Graham, behind the counter, Cilla Black. Interesting fact about Rory, who is 6'7". Never been asked this before. You once auditioned to get on Blind Date, didn't you? Yeah. And failed.
I did.
I mean,
I failed fast. Wasn't that what they said we had to do earlier?
Yeah.
Some so-called friends decided they'd send off an audition form. See, consent is required nowadays for these sort of things. So I thought I'd go anyway. But that then sprang me on to just getting married and sorting it all out, so I don't have to do that
ever again. What was the question that you failed on?
I had to ask someone out and do an impression of Prince Charles
Okay. We've got the video. Okay. No, we haven't. We haven't. We're going to talk about 6'7". You wouldn't have to pull the screen back, would you? Your head sticking at the top of it as well. So let's talk about Gendius. You set it up in 2015. Very personal, because your co-founder, Chris Gendius, developed type 2 diabetes, which is interesting, because we've just spoken to Emma-Louise about type 1 diabetes. So just explain the background to the business.
Yeah, so Chris and I both came from a pharmaceutical background. When he was 50, he was diagnosed with diabetes. And unfortunately, in his journey, 2 years in, he had his first foot ulcer. And then soon after that had a small heart attack as well. So he wanted to do something where he could make it easier for people with diabetes to manage their diabetes, but also look at that sort of sat-nav, the way forward, because there's tons of diary tracking apps and things out there. But what we were trying to do was trying to show patients what the journey ahead is, and to make sure they were aware of some of the horrible consequences long-term that could happen. So try and flag these things and try and help them with things they could be doing early on to try and prevent those things from happening.
I try and keep things really simple, because I'm a really, really simple guy. But so what you've got a number of patients who've got type 1 or type 2 diabetes in this case as well. And do you know that a percentage of those will probably get acute kidney failure?
Yeah.
Oops. So your technology, if you like, is to work out which ones of those are most likely to develop kidney failure and which ones aren't. Is that right? Would that be an accurate description?
Yeah, there's two elements. The original premise was we built an app-based platform to remote manage patients with their clinicians. And then more lately, it's the stuff that Mark talked about in the when he demoed it earlier on. So we've now moved further with that, with data sets, and we now can predict which patients are likely to have a positive test or a negative test, if you want to look at it with regards to having chronic kidney disease. So who's likely to have chronic kidney disease now? So it's like a pre-screening algorithm that we have.
And what would be the red flags? What would you'd look at? What what would it be?
Well, that was a big challenge for us. So it was about having something that we could scale, particularly looking at developed markets. So we have 5 really simple inputs. So it's body mass index, your height and weight, age, gender, how long you've had your type 2 diabetes for, and then the 5th, which my team will tell me off because I can't remember what it is now. Blood pressure. There you go.
We'll take that away. You never know after lunch, do you? You never know. You collect 30 million data points from 128,000 patients. So how accurate is that data?
Well, so we're not a device. We're not as good at the end of the spectrum of where Keith is, or some of these pumps and meters. So what we are is we're a pre-screening tool. So the issue with diabetes, when you look at it, is everyone every year is asked to go for their tests, so their screening tests, and the kidney test is one of those. Now, if you test everyone for what's called an EGFR test, about 20% will come back with a positive test. So 80% of patients are being screened for that test, in theory, when you don't need to. So, so for us, it's a real numbers game. It's about how we can, with some certainty, identify that 20%. So our algorithm can reduce the group you need to test by up to 50%, but still identify most of the 20%. So it's a numbers game. So we're not a diagnostic. We don't replace those tests. We simply just sit there at the front end really easily, and you can quickly identify who's at highest risk.
I've got a question I want to ask you, but has anybody got any questions they want to ask any members of the panel? Like I said, I'm keeping things moving on. So the analogy I was going to use was a bit like a COVID test as well with your technology. So, most people have got a basic lateral flow test in their house, but if you needed something more accurate, you go and get a PCR test as well. Is that the way your technology works? It's like a screening, and the ones where a red flag comes up, they will be diverted for more follow-up care. Is that the way it works?
Yeah, I mean, the advantage we have is it's not another test to go to another test. In effect, we've just got 5 simple inputs, but it's exactly that. It's who do you send on for the more expensive test that's more accurate? So in an environment where, for instance, during COVID, the data from Manchester, from the Greater Manchester Care Record showed there was a 40% reduction in screening that happened during COVID. And then now we're into winter, and we've got the issues with doctors and nurses and everything else. So trying to catch up that 40% again is really hard. So what we can do is give them a list of all the patients from highest priority to lowest. And then if it helps them, they could take the highest lot, or they can decide how they want to manage it. But it's just a simple way of telling them who's highest.
Final question, actually, and I've got about 5 or 6 requests from members of the audience. I'm going to have to respond to that, but I'm not leaving any earlier than I'm supposed to. You're based at Audley Park. You just raised 3.5 million. Do you see yourself as a healthcare business or a data business?
data now, I think originally we set up with the premise of helping people with diabetes. We still do that, but for us, data is absolutely key. So the way we've got to where we are is by getting longitudinal data sets. So we have followed patients over a 10-year journey across a whole load of metabolic markers, everything from age, gender, cholesterol. And so we have these data sharing agreements with about 100 primary care practices in the UK, where we can access anonymized data that's consented. So very much a data business.
Okay. 2 quick plugs, actually. Colleague on the front row is John Simcox. He's the editor of Business Cloud and Tech Blast. He's a hero, that guy. So if you've got any stories or anything that you want to engage with us, please do as well. A number of people have contacted me and said, Chris, do you do a podcast called Northern Spin, which is available on all good platforms, that looks at politics across the north with Michael Taylor? I mean, a lot of people are asking. That's true. Yeah, it comes out every Monday. We are available, looking for more sponsors, Cowgills, as well, but available on all good platforms as well. Thanks very much for your time. Thanks very much to Emma, to Keith, to Rory, to James for being such good fun as well. And thanks very much to the lady on the front row for having such a good sense of humour about her amazing plate of food there. So thanks very much. Thank you.